Hello everyone, today we are here to learn about intramuscular injection. So firstly, what are injection? Injection is a procedure in which prescribed dose of medicine is administered using syringe and needle into the body. So let us focus on the one of the root of injection, which is intramuscular injection. IM injection is administration of medicine into the deep muscle tissues of the body.
Objectives: at the end of this session you will be able to learn what is IM injection, the purpose of giving IM injection, indications in which condition we should give IM injection, contraindication in which condition we should not give IM injection, 3 checks and 10 rights of administrating IM injection, sites of IM injection and scientific principle used in IM injection, articles required, after care of article and documentation.
IM injection to reduce symptoms of illness, to obtain acute effect of medicine, for prevention of disease, to promote health, to obtain maximum effect of drugs in unconscious patient. Contraindications of IM injection: impaired coagulation mechanism, occlusive peripheral vascular disease, edema, shock after thrombotic therapy.
Principles of administration of medication. There are 3 checks. First check when obtaining the medicine from the container, second check when removal of medicine from the container, and third check when replacing the medicine from the container. There are 10 rights. First of all, right patient, right medication, right dose, right route, right time, right refuse to drug, right information on drug, right assessment, right documentation, right evaluation.
P's are very essential in every nursing procedure. First of all, first P is preparation of the patient. We have to explain the procedure to the patient to gain his trust and cooperation while doing the procedure. Preparation of articles. A clean tray containing 1 syringe, 2 needles, one is for administering and one is for loading the injection, and the prescribed medicines, which can be ampules or which can be vials, an ampule cutter and spirit swab, and kidney tray for discarding the waste. It is preparation of the environment. In preparation of environment, we have to provide the adequate light to the patient, and we have to give privacy to the patient by putting screens on or the curtains on. Last P is preparation of the nurse. Nurse should be knowledgeable and skillful about every procedure. She should have done hand washing before and after the procedure, and she should wear the gloves to prevent cross infection.
It is a tray prepared for IM injection, a clean tray containing a prescribed medicine, a sterile syringe and sterile needle to inject the medicine, a 20 gauge needle to load the medicine. This is medication card to ensure the accuracy of the medicine, a pair of clean gloves to prevent the cross infection, a bowl containing spirit swabs to clean the site of injection, a bowl containing dry cotton swabs to apply after the injection, a spirit to maintain the hand hygiene, a paper bag to discard the dry waste, and a kidney tray to discard the wet waste.
So let us move towards the sites used for intramuscular injection administration. So first is gluteal, second is deltoid, third vastus lateralis, fourth rectus femoris. So first we will see gluteal side. So first is ventrogluteal. So we have to feel the iliac crest and place our hand on the greater trochanter and feel the middle point of the index finger and the middle finger and insert the injection, that is the needle, in the middle point of the index finger and the middle finger. Next is dorsogluteal. So in this, what we have to do, we have to divide buttocks into 4 quadrants. First, second, third and fourth. We have to choose the outer upper quadrant for the inserting of the injection.
Muscle for IM injection is vastus lateralis. So divide the thigh into the 3 parts and place the needle into the middle outer aspect of the thigh, which is vastus lateralis. Next is rectus femoris. So here also we have to divide the thigh into 3 parts and place the needle in the inner aspect of the thigh, which is rectus femoris. It is moved to the next muscle of IM injection, which is deltoid muscle. Now how to locate it? Place the finger below the acromion process, leaving the 3 finger distance such that it forms a triangle, and place the needle between the 2 fingers, which is index finger and the middle finger.
Check for the acromion process. Place the hand in a triangular manner. Check for the midpoint. Then Clean the midpoint using a sterile swab with a cotton to clean the area. Then take the needle. Ask the patient to take a deep breath. लांब श्वास घ्या. थोडंसं दुखेल. Instruct the patient in such kind of manner. Keep talking with the patient continuously. लांब श्वास घ्या.
Aspirate to check whether the
अजून
blood
थोडं
is coming into the syringe or not.
झालं. थोडंसं दुखतंय का? थोडंसं हळू. झालं. Very good. And for the removing of the needle, get a normal cotton swab, place at the insertion of the needle and get the needle out from the area. Then circulate in a circular manner in a very proper way for the absorption of the proper medication.
Administrating the intramuscular injection, keep in mind the instructions according to the checklist. First, gather equipment supplies, alcohol swabs, medication card, medication, gloves, syringe with extra needle, kidney tray and paper bag. Second, identify the patient as per hospital policy. Third, check the patient chart for allergies. Fourth, explain the procedure to the patient. 5. Perform hand hygiene. 6. Provide privacy. 7. Select appropriate syringe and needle and check if it is working condition. 8. Recheck the order in the medication card with the table of the medicines for name, dose and expiry date. Follow the rites of medication. 9. When drawing the solution from the bottle, first draw air into the vial, expel air into the vial and withdraw the required dose of the drug. 10. Carries medication to the patient and identifies correct patient. Perform hand hygiene. 11. Perform hand hygiene and don gloves. 12. Identifies the site. 13. Prepare the site for injection by cleaning with alcohol swabs with circular motion. 14. Insert the needle at 90-degree angle. 15. After needle is inserted, withdraw slightly and push the plunger down slowly. 16. Withdraw the needle and place the cotton ball over the site of injection. 17. Massage the area, inspect the area for bleeding. 18. Watches the signs and symptoms of allergic reaction. 19. Places patients in comfortable position. 20. Replaces the articles of dispose the sharps as per hospital's protocols. 21. Washes hands. 22. Records the procedure with date and time.
Scientific principles for injections. Anatomy and physiology. The skin contains blood vessels and nerves. The common sites for injections are intramuscular, intradermal, intravenous, and intrasubcutaneous. Intramuscular injections are given to gluteal, deltoid, vastus, lateralis, and rectus femoris. There is a blood vessel supply and poor supply of sensory nerves in these muscles. Microbiology. Wash hands before and after the procedure and avoid cross infection. Use syringe and needle for each patient. Use severe water for dissolving drugs. Close the top of vial with spirit. Swabs before inserting needles into the vial. Clean and discard the waste materials in appropriate container. Physics and chemistry. Pressure is related with all needle injection. When injection is drawn from an ampule into a vial through a syringe, pour the needle and put into the fluid and piston is pulled back. Pharmacology. Various classes of drugs are given through injections such as remedial, preventive, diagnostic. Insulin is always administered by subcutaneous because insulin is destroyed by the digestive enzyme. Psychology. Explain the procedure to the patient to gain confidence. Clear all the doubts in simple language.
Documentation and care of articles after it is used of iron injection are: take the articles to the dirty utility room, discard the waste material with soap and clean water and replace in the proper place, wash hands, record the medication of the patient given the medication, its route, time, all in nurse's note. Observe the patient for the 15 minutes while when the administration is over for any signs and symptom of the drug.
Then notice the skin discoloration. Is there any itching, discomfortness, or inflammation, etc.? Thank you.